Hey, happy, beautiful, amazing day. Dr. Bob Rakowski here. Decided to make a video because I get this question so often. Can I take spores while on blood thinners? And so Organo is operational in 59 countries. One country, that being Canada, basically says on the bottle, don't take spores with blood thinners. So, or at least warning about that. So what do they know that the other 36 operational countries don't know? Or could it be that their attorneys are just ultra cautious? Well, I don't know if you can take spores on blood thinners or not, but your body knows. So there's a test called PT-INR. That stands for prothrombin time with international normalized ratio. This is a standard test of clotting speed. Now, in my experience and in the literature, it shows that when people take blood thinners, they're at risk for a lot of bleeding episodes. And many of them have them, and some of them are fatal. Now, that's not to put fear in anybody, but it's to create wisdom to say, if you're going to take something like that, you need to know how it's affecting your body frequently. Now, could be debatable about whether or not the individual needs the blood thinners. I promise you, I've seen plenty of people that they were able to get healthy and get off of blood thinners with no flack from their medical people. But test the PT-INR test. If you're in the US, you can have directlabs.com, anylabtestnow.com, and you can order it yourself. You don't need a doctor. Other countries, you may need it. But get a baseline on your test. You may find out that if you're taking blood thinners, you're already too thin, that you're bleeding too much. But then once you have that, start taking your spores and or your King of Coffee. By the way, the reason I show the King of Coffee is no country has a warning label on the King of Coffee. So isn't that interesting? Even though the King of Coffee has a spore in it, the equivalent of that, no warning label for that. So here's the rule. If you're not assessing, you're guessing. Anytime you're taking a medication that's changing or controlling your chemistry, whether it's blood pressure or blood thinning or whatever, you should know what it's doing in your body and how it affects it long term. So one more time, can you take spores while on blood thinners? I don't know. Most of the countries, like 35 of 36, don't feel the need to put a warning label on it. And in 8 years of having my patients test, I haven't found anybody have an adverse reaction. Now, with that said, maybe you could be the first. So you're going to want to know that. Test it. And if you don't mind, post your results in this group. I'm Dr. Bob Rakowski, absolutely knowing we can all be happy, healthy, and successful.